So I think we've heard a little bit about burden of disease, and my focus really today is going to be talking about burden of disease in the United States. Okay. Here are my disclosures. Some of them are relevant to the disease, but not this talk per se. And over the next couple of minutes, hope to describe the prevalence and incidence of HS in the United States, and also discuss some of the utilization patterns that we've observed in sort of addressing this burden. I thought I would just first start by adding some context around why it's important to establish burden of disease. It's not the most exciting sort of topic to read about or even to research per se, but it has very specific purposes in healthcare. It allows providers to understand or really become more aware about the disease, to allow providers to identify patients at risk for the disease, helps to establish the research agenda, helps patients and other public stakeholders to plan initiatives around education, for example, and advocacy, and even has a role for policymakers in setting the national health agenda. There are several challenges to studying HS because in the grand scheme of things in overall medicine, aside from the significant life impact we know it has on patients, it's a relatively uncommon condition. And I think that's probably one of the reasons we see publications, for example, in HS lag so far behind other sort of inflammatory skin diseases. And most of our literature to date is comprised of reports, small sample size studies, cohorts which may have poor generalizability, several biases related to the cohorts, and even in some cases lack of comparator cohorts. And so when we look at prevalence estimates, really in the world, we see quite a range, and a lot of it is related to the different areas from which we sample these patients. Of course, the different methods by which we acquire the data. There's claims analyses, claims mixed or combined with chart reviews, and then the other major method we've seen is self-report questionnaires from patients. And many of the populations just have some biases that sort of need to be overcome. Oh, I pushed the wrong one. Okay, good. So just to add some context, I thought I would actually provide some data from Europe, which is really where a lot of our burden of disease data comes from. This was a study, I think this is John Review's study back in 2008, where he proposed the question here to a population of 10,000 patients, of whom 70% responded. So if you guys know about like questionnaire responses, we're lucky if we get to like 25, 30%. This is 70, so it's a highly motivated group in France. They found 67 cases based on this question, which yielded an adjusted prevalence of 1%. I don't think there was a lot of sort of validity around this question, but certainly a well-worded and descriptive question to sort of put out there. Gregor Jemic and his group had done this some years before, a slightly different question, or really two questions, and the cases were confirmed by yes to the first question and no to the second question, and they surveyed 8,000 patients, and there found also a one-year prevalence of 1%. With some subsequent work, and in this case, Gregor's group really sort of refined the question, combined it with also lesion counts, and then did some validation studies around this with 30 patients, and showed good performance of this question. And so when put it out to a larger Danish population of around 17,000 patients, found a prevalence of around 2%. And interestingly enough, this didn't include patients that were younger than 30. And so for HS, that's important. And so maybe this 2% is maybe even more like 3%, which puts it to be on par with, let's say psoriasis, for example, in this country. So that is seemingly very common. So what about in the United States? This was a study, I believe it was a Janssen-sponsored study where they looked at almost 8,000 patients. And the way they gathered their cases was through ICD-9 coding, through CPT coding, so procedures used for HS, but also used for other conditions, so not necessarily specific for HS, or some combination thereof. So they looked at sort of different algorithms based on their method. They only looked at commercially insured patients and found an overall adjusted prevalence of about 50 patients per 100,000. So like an order less than what we're seeing in Europe. This was a Marks Davies study out of Mayo, where they looked at the population in Olmsted County and chart verified about 180 cases of HS. There are some limitations to really kind of evaluating a population in terms of demographic heterogeneity in Minnesota. So most of these patients, not surprisingly, were white. And they overall had some limitations in sample sizes, but found about double, the prevalence from that previous US study of about, let's say, a little over 100 per 100,000 patients, but still an order of magnitude less than what we're seeing in Europe. We were able to look at this sort of on a population level, but not necessarily county specific. This database that we're working with has over 50, I think at this point almost 60 million lives, which represents like a sixth or so of the population of the entire population of the United States, representing all 4 census regions and demographic data, insurance data that really sort of is similar to what we know to be the case in this country. So it's quite powerful just because it has a high number of unique lives, but it's also robust because unlike claims databases, also we get a look at actual clinical data, lab values, demographics, vitals, and things of this sort. So we found this to be very useful and did some validation studies within this database, and now have a cohort of over 50,000 patients with HS. And so we thought this was a good database to really try to kind of understand the true burden of disease in the United States. This is a very busy slide. Does this have a point? Okay. I'll just try to walk you through this on a high level. So this is our crude data. This is the data that we actually got from our database. And this is when we standardized it to US Census data. And then this prevalence is a standardized prevalence, so this is when it's standardized to census data. And what we found is an overall prevalence of 0.1%, which is actually almost exactly what they found in a smaller county or a smaller area in Mayo, in Olmsted County. And not so surprisingly, we see the overall prevalence to be between 2 and 3 times greater in women than in men. Here are the age groups that we have known sort of HS to predominantly affect. But for me, this was really the most remarkable finding down here. When we, a lot of us take care of HS patients, and at least in this country, I would say that based on the data, the disease burden data, you would never think a black patient can get HS. Because all of the papers on disease burden either don't comment on race or the populations are predominantly white. And that's not quite the experience, I think, for many of us caring for HS patients in this country. And so this was data that was helpful and just at least reflecting our experience, but clearly showed that black patients were disproportionately affected with this condition. Okay, and what about incidence? So this was Mark's study, again, out of Olmsted County. And when he looked at, basically 10-year intervals, he saw increases, over the past several decades in the incidence, so new cases of HS. And the most recent data in, basically 2000 to 2008 showed an incidence of about 10 new cases per year per 100,000 patients. So we also wanted to look at new cases or incidence of HS and used the same database that I mentioned. And you're seeing, I think, a story here that parallels what we saw with the prevalence data. And the overall incidence actually is, again, similar to what they found in Olmsted County. So somewhere around 10 new cases per 100,000 as a one-year incidence, and overall increased above the 10-year average annual incidence. And more new cases in women, more new cases in patients between, let's say, 18 and 50, and significantly more new cases among African Americans, 3 times as much. So again, a similar story to the prevalence data. The limitation of claims data, and ours was claims data as well, is that we can only capture the patients that are diagnosed. And we know one of the major problems we're having with HS is that there are too many patients that are undiagnosed. And that's certainly true in this country as well. And this is, I think, perhaps the best data to date that suggests delays in diagnosis. So really our challenge, and Ilt kind of mentioned this before, we got to kind of stand on top of mountains and scream about this disease so that there's really more disease awareness around this in the public and medical sectors. We believe as dermatologists, we know this disease, we can diagnose it early, and we can even probably manage it as capably as anybody else. And actually, we wanted to try to sort of show that, or at least know if that was the case. And so this is data where we looked at 400 patients and followed them over 5 years. I've got listed here treatment. We divided treatments up into different levels, and probably there's no one uniform algorithm to treating or managing HS patients, but this is, say, one where you start with no treatment as the lowest level and maybe work your way up to surgery. And what we wanted to do is just understand what were factors related to treatment for patients with HS. And remarkably, just point out one data point in this study, it was a visit with a dermatologist that provided the greatest odds of a patient receiving any treatment, okay? And it was a visit with a dermatologist that provided the greatest odds of a patient escalating treatment based on that algorithm. So there are many patients with HS who remain undiagnosed, but there are also many who are not on treatment or not advancing treatment, and we know that dermatologists really should be involved in the care of those patients. The problem, okay, with that is that for some reason, most HS patients aren't seeing a dermatologist, and this is really stunning. Overall, only about 1/5, okay, of patients have seen a dermatologist. And you might ask, well, maybe it's related to like insurance or maybe some other factor. And the truth is that at least insurance wasn't involved. There's some other factor other than insurance type that's accounting for HS patients not seeing their dermatologist. And I think it goes back to really disease awareness, both in the public and medical sectors. So we're doing a lot. This organization is a big piece of it, but there's definitely more that needs to be done. Part of it is just really understanding this disease from the perspective of patients and making sure that their voices are heard. And so there is an initiative, which I think many people in this room are part of, a global survey, which is a patient survey in which we ask about some information about their demographics, issues around their diagnosis, their symptoms, comorbidities, their management, and of course their life impact directly from patients. And what is, I think, going to be unique about this is really a worldwide initiative. There are, at this point, 45 sites over 25 countries and 5 different continents. So we are really going to hear from patients about their disease, and I hope this is something that can really help get the message out there about HS, and not just among dermatologists. Actually, we need to get it out there among everybody else, and as well as in the public. If you're not part of this site, part of this initiative, we want to hear from you and really hear from your patients. So we want to include you as a site. Is Erica in this room? Erica, stand up. This is Erica Nurin. Find her, and she will figure out how to get you on board. We've just started enrolling patients. There's a handful of sites up and running. So this is a perfect time to jump on board. And that's it. I just wanted to sort of acknowledge all of you. I think it's a credit to all of you, as Ilt mentioned, to kind of take your time to be here. And there's some terrific organizations led by really wonderful people who are doing some great work in HS. And I hope it continues from here. Thank you.